Hello, Christy. My name is Danielle and I'm going to be your nurse today. We're going to perform an assessment on the musculoskeletal. So I'm going to pull the curtain to provide you your privacy. And I'm going to ask you your name and date of birth.
Christy, 12/15/86.
I'm going to perform some hand hygiene. And then I'm going to assemble and clean my equipment. So as I stated earlier, what we're going to be doing is an assessment of the musculoskeletal. And I'm just going to have you, I'll just be inspecting your neck and your arms and your legs and have you do some range of motion as well.
Okay.
Just some history questions before we begin. Do you have any swelling or stiffness?
No.
Any muscle pain or any cramping?
No.
Okay, so first I'm going to look at your jaw and inspect your TMJ bilaterally. Then I'm going to palpate it. And we will perform some range of motion. So if you will, Christy, please open and close your mouth. Perfect. Next, I'm going to inspect your neck. Just looking at the skin color and if there's any redness, inflammation, and we will begin. So palpating the neck. No swelling or any pain when I was touching these areas,
No.
palpating these areas.
No.
For the range of motion, I'm just gonna have you push against my hand with your neck. There you go. And we're going to test the muscle strength also of the neck. Very good.
It's the same weight.
Oh. Okay, go for your muscle strength. Perfect. And we're gonna look at your shoulder. I'm gonna inspect your shoulders and palpate them as well. Again, looking for any abnormalities. Range of motion, can you just shrug your shoulders up and down? Perfect. And for strength, I'll just put my hands on top of your shoulders and try and push up against my hands. Okay. Elbow, I'm gonna look at both of the elbows and palpate the elbow. Range of motion, if you can just bring your arms in and back out. Extension and flexion. And then for strength, I'll just put my hands on top of yours and then you can try and bring your arms in. Go ahead. Okay. For your hand, I'm gonna inspect your hands.
Make this in the full.
Inspect. No abnormalities. I'm gonna palpate your hands, and for range of motion, if you can just in and out. Yep, perfect. Wrist, inspection, palpation, range of motion. Okay. And same thing for strength. Okay. And then we're going to, for the Fallon test, you're going to push back on each of the fingers. You're going to point them down and let me know if there's any pain or burning.
No.
Okay. For the Tinel test, we're gonna. Oh, that's for the carpal tunnel. And nothing?
Mm-mm.
Okay. If you can stand up for me, we'll look at the lower extremities. We're
Are you
gonna
doing
do
the table test?
hip. Okay. Hip inspection on both sides and palpation, and then range of motion for your hips.
You like
Yeah. Circular motions. Okay. And for your knee, let's look at the knees and palpate the knees. And range of motion, if you sit back down and then just raise each leg back. And for strength, just push up on my, on my hands. There you go. Ankle, again, inspecting both of the ankles. Palpation. And range of motions, if you can point, bring them out and in. And strength. Pull up. Perfect. Same thing with your feet. Take your socks off, and then we're going to palpate them. And range of motion. Wiggle everything. And then for strength, can you bring them back up against my fingers? Perfect. The spine, I'll have you stand back up and I'll just have you turn around and look at your spine. I'm gonna palpate it again for any abnormalities, any curvature to the spine. And for range of motion, are you able to bend down, back up? Perfect. You can have a seat. So we are all done with this assessment, and upon this assessment there was no abnormalities, no skin lesions, no inflamed joints, no cracking noted when you're opening and closing your TMJ, which is your mouth for that joint. Everything appears to be within normal range as far as your range of motion as well. So is there anything else that I'm able to do for you before I leave?
No.
Okay, perfect.